4 on KUTV.
February is American Heart Month, and despite all of the awareness campaigns, cardiovascular disease still remains the #1 killer of women and men in the United States.
That's right, and our partners at Intermountain Healthcare say their heart patients are getting younger.
Just had some chest pain and some shortness of breath.
6 weeks ago, 46-year-old Douglas Burgoyne knew something wasn't right.
I went to see my primary care doctor. My doctor said, well, I think we ought to have you be checked out for, cardiac disease.
Doctors would have to put 4 stents into Douglas's heart to help prevent any future heart attacks, and his case is not uncommon.
Yeah, even if you're young and healthy and you don't have any hint of any medical problems, it's still probably a good idea to get a checkup.
Dr. Kent Meredith is a cardiologist at Intermountain Medical Center Heart Institute. He says he's seeing patients in their 30s and 40s with heart disease. Heart disease remains the #1 killer here in America. Dr. Meredith says there are things you can do to prevent heart disease.
The most important thing I'm going to recommend is that you exercise. I don't think anybody would argue that that's something that most people don't do enough of.
The second most important thing that he's going to recommend is to change your diet.
I generally recommend that patients eat food that they either have to dig up and wash or peel or take the shell off, because those foods are probably going to be better for them.
Another recommendation is to have your weight, blood pressure, and cholesterol levels checked regularly.
And if you can kind of get that out there and realize if your doctor says your BMI is getting up there and it's a little bit outside of the healthy range, then maybe you can talk about some ways to set goals and work on that.
Now, heart health will be the topic of our Ask the Expert segment today, and we'll have the experts here from Intermountain Healthcare to answer any questions you might have about heart disease and prevention. The phone line's open at noon. Write the number down. It's toll-free 877.